Okay, hello, and welcome to this COVID-19 update on the coronavirus. And unfortunately, the numbers are going up again, and it's getting to a point where I'm starting to feel uncomfortable. And we're going to talk about this because it's happening across the entire country. It's happening across the world. There's various factors behind this: the weather, less sunlight, so that runs down people's immune systems. Less vitamin D, less uh, the sun itself, actually, the ultraviolet rays help kill the virus. So with less sunlight, you're going to have more of a spread. The weather changing, and people's behavior. The one thing we can change is our behavior, and I think that's also contributing to this rise. So this is the number of people tested versus the percent positive, and you'll see it's starting to go up. Yeah, sure, it's nowhere near what we were at um, before, but it's going up. And this is what the latest results are with the infection rates tested positive. All right, so you'll see here if you look, capital region remains pretty decent, but if you look at Long Island, it's gone up. Percent positive yesterday was 3.3% on Long Island. It's 2.7% for. Let me move this over so you can see everything here. What just happened here? All right, it just refreshed, I guess. But you will see here that Long Island was yesterday 3.3%, and this a 7-day rolling average is 2.7%. So ideally, you want to be at 1% or below. All right. Mid Hudson also up there as well. And New York City also not as high as Long Island, and then Western New York as well is up there as well. So New York City is yesterday tested 2.8% positive. The average is 2.2% positive. Again, a real concern here. Let's see if we can change this to just Long Island. So waiting for it to load here. You can see it's starting to inch up a little bit. All right. So this is all a concern, and so if we go to this Nassau Corona cases by county, cases by the spread is accelerating. All right, and you will see here, and this is very interesting to look at these numbers because if you'll notice, the higher numbers tend to be on the South Shore. If we look at Belmore, for instance, 409 new cases in I guess this is one day. Is this every? Yeah, this is the daily. Is this the daily or the weekly totals provided by the county? From when though? They don't say from when. But anyway, you'll see that the higher numbers: Belmore 409, Carl Place only 164, East Massapequa 506, East Meadow high as well. East Williston's very low, 44. Garden Freeport 1,962. So it seems like the South Shore, but Glen Cove is also up there. So let's see how Mineola is. Hopefully we have a low number in Mineola. 514. Okay, so it's not. At least it's not as high as some of the others, but it's definitely going up, and it's heading up in a lot of communities. Here's a cases and new deaths, so you can see the new cases. Fortunately, the death number is low because we are able to keep up at the hospitals. We're able to manage the symptoms. We know how to treat it a lot better. But we have to start taking some steps to try to, stop this a little bit. Reasonable steps that I agree with. And New York is following New Jersey. First, I'm going to start with New Jersey because New Jersey. We'll start with New York. It's basically similar to something that they're doing in New Jersey. So basically, the hours of bars, restaurants, gyms, and parties were basically turned into a whole yellow zone, basically, if you know the cluster management system. So amid rising coronavirus cases statewide, New York bars and restaurants that sell alcohol and gyms must close by 10 p.m. The state will also limit private house parties to no more than 10 people. If a household contains more than 10 people, no more than those living in the household will be permitted. The new rules go into effect Friday. And Cuomo said contact tracers identified these three areas that are main drivers behind the spread of the virus: establishments that sell alcohol, gyms, and private house parties, such as gatherings for football games. Bowling alleys that sell alcohol will have to close by 10 p.m. If the lights are on and people are drinking, they'll get a summons. But what about those gatherings in Belmore with those hundreds of people gathering? That should be gotten. That should be stopped too. Um, Restaurants will be allowed to sell food for takeout after 10 p.m. If those measures are not sufficient to stop the spread, we'll turn the valve more, and that would be reducing the number of people who can do indoor dining. So that means they have to reduce the percent from like 50 down to like maybe 25%. And if that doesn't work, then we could have to go to a mass shutdown again. The drastic rollback comes as the state's positive corona test rate, excluding the microclusters areas, hits 2.5%. The positivity rate, including the zones, was 2.9%, and the rate within microclusters was 4.9%. On Wednesday, 21 more New Yorkers died of COVID-19. 1,626 were hospitalized, 304 were receiving intensive care treatment, and 135 were intubated. Given positive news results about a vaccine, America is within sight of the finish line, Cuomo said. Let's just do what we have to do to get through it. And, I agree with these things. Slowly, we have to start being more cautious again. This follows what New Jersey did. So we're going to look at New Jersey. Phil Murphy said COVID-19 numbers going in the wrong direction. And he was speaking during a Monday news conference saying that New Jersey COVID-19 numbers are going in the wrong directions, and as he announced new restrictions on bars and restaurants, along with limits on indoor youth sports. Hospitalizations from COVID-19 have risen above the 1,500 mark since the first time since June. Some of this is now attributable to indoor dining. So he says some people have gotten sloppy with managing the coronavirus at these establishments. Fortunately, where I eat, people are, wearing the mask. If they weren't, I would not be eating there. All right. If the people working there didn't have masks on, there's no way I would go in there to eat. All right. So a number of bartenders have been infected with the virus. New Jersey is back at levels we thought we left behind months ago. The numbers are going up and in the wrong direction. On Monday, there are 2,075 new cases of the coronavirus, putting the state total at 256,653 since the start of the pandemic in March. New Jersey announced its highest daily case total since April, 3,877, and the state's highest death toll since July 21st. The positivity rate in New Jersey is 7.54%. So that's why I really have no plans to go to New Jersey anytime soon. Murphy said New Jersey has 1,537 patients hospitalized due to the coronavirus, with 1,313 known positives and 224 awaiting confirmation. There are 309 people in intensive care, and of those, 97 were on ventilators. The number of ICU patients was at its highest since June 17th. The good news is that we're more prepared. We know a lot more. Murphy said, noting ventilator use is lower, but people are still dying. 11 new confirmed deaths were announced Monday, bringing total deaths in the state to 14,640. Murphy said the details on the restrictions for bars and restaurants include no more service while sitting at the bar because state officials have seen an increased numbers. Yeah, the bars should not even be open, I don't think. Food and alcohol will not be permitted to be served inside establishments after 10 p.m., but restaurants can continue indoor dining since 10 p.m. Past 10 p.m. Outdoor dining after 10 p.m. The ban on food and drink service after 10 p.m. applies to casinos as well. They will be permitted to keep gaming open all hours, but no food or drink can be served at 10 p.m. People start to let their hair down at clubs, lounges, and restaurants, particularly restaurants with bars. People are getting sloppy in and around bars as the night wears on. We're not sure why bartenders are more at risk, said Judith Purcelli, the state's health commissioner. But she said there have been a lot of outbreaks, especially tied to bartenders. With the ban on bar seating, restaurants will be permitted to move tables closer than 6 feet as long as they install barriers between them. Murphy said outdoors, restaurants will be allowed to create fully enclosed dining bubbles limited to one group of diners each because of the coming cold weather. I really like that idea, by the way. I think that's pretty cool. Indoor health sports events up to and including health high school age athletes are banned because of an increase in transmission seen among youth sports. Murphy said the increase has been notable in indoor hockey and that state officials have specifically traced outbreaks to interstate competitions and tournaments. There are transmissions happening in a number of different areas. We know opening indoor activities, we are taking some amount of risk. Murphy called the restrictions surgical steps. No one up here wants to do the kinds of broad actions we did in March, Murphy said. We have to change our mindsets and shake off the pandemic fatigue. We have a 6-month window to beat the fatigue back, Murphy said, so we can ultimately defeat it for good in the spring. Murphy said on Friday New Jersey would take broader steps to quell the recent recent sharp rise in coronavirus cases in the Garden State. So again, this is people being careless in the bars. People are drinking. People are loud, and honestly, we may have to close the bars down again. At this point, going to a bar and getting drunk is not an essential activity, and I don't want to have to go and not be able to eat inside because of people drinking. All right, because where I go to eat, it's not like that at all. All right, I don't eat in those kind of places. All right, so I agree with these steps. I think they are the right thing to do. We don't want to go toward a full shutdown, but at the same time, we have to be careful. And honestly, I don't think enough is being done. I think and I've said before a million times, people that don't refuse to wear a mask need to be put in jail. All right, if you don't want to wear a mask when you're within 6 feet of other people, especially on public transportation, and you've been told numerous times, then you need to be put locked up. All right, because you are putting other people's lives at risk. All right, and I'm tired of these people who don't care about other people's health. I've seen all kinds of people. It's not just a certain demographic. All kinds of people from all walks of life, all races, that I've had to deal with on the bus and on the train that are not wearing the mask, or they got it covering their mouth and not their nose, and we cannot. And the attitude, some of them are very nice and say sorry and they put it up, but some of them, like there's one incident in Hicksville, the guy's like, I'm okay, and I'm like, no, it's not okay, because your nose is exposed, and there are people within 6 feet of you. You could be spreading the virus, and maybe you could fight it off. Maybe the guy next to you could fight it off. What about somebody who can't fight it off and winds up in the hospital? He didn't care. He just swagger walked away from me. So, I'm tired of this. And a lot of this is attributable to the president, of course. Trump, honestly, his attitude toward the whole thing. So, and Joe Biden said, wear a mask. It saves lives. Please. We don't want to go through a whole shutdown again. All right? But that's what's going to happen. And if the numbers keep going up, I'm going to be uncomfortable eating out as well. So, I'm already starting to get uncomfortable with it. All right? But fortunately, where I go, it's not that crowded. And I'll be avoiding the South Shore because the South Shore is more crowded. And I find that I run into more people, at least in establishments, like places like restaurants and stuff, that don't want to cover they don't want to wear a mask. I seem to see it more in Belmore, where people literally, I see people ordering and they're not wearing masks, or the mask is not covering their nose. I never see that in my area. So it's just another reason I want to avoid the South Shore. Because it puts me at risk for my own health. So that's going to be it for this video on the coronavirus update. Let's hope that we don't go into some drastic shutdowns. I know I was angry when I thought of the idea, but there are reasons why this happens. And if the hospitals get to the point of being dangerously crowded and can't take care of everybody, that's when you have to have a mass shutdown like you had in April, and I could understand that. If there's a risk of that happening again. You have to look at the science and not look at the rhetoric. Take care, everybody, and thank you for watching.